Hi everybody, this video of mine is about dengue fever, which is a mosquito-borne disease that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high fever, rash, muscle and joint pains. A severe form of dengue fever, also called dengue hemorrhagic fever, can cause severe bleeding and a sudden drop in blood pressure that can lead to shock and death. Millions of cases of dengue infection occur worldwide each year. Dengue fever is most common in Southeast Asia and the Western Pacific Islands, but the disease has been increasingly rapidly in Latin America and the Caribbean. Researchers are working on dengue fever vaccines. For now, the best prevention is to reduce mosquito habitat in areas where dengue fever is common. Now let's discuss some of the symptoms of dengue fever. Many people, especially children and teenagers, may experience no signs or symptoms during a mild case of dengue fever. When symptoms do occur, they usually begin 4 to 7 days after you are bitten by an infected mosquito. Dengue fever causes a high fever up to 104 degrees Fahrenheit and maybe more, and at least 2 of the following symptoms: headache, muscle, bone and joint pains, nausea, vomiting, pain behind the eyes, swollen glands and rash. Which means that with the fever, if 2 of these symptoms which I have just described, if they are present, then the diagnosis is labeled as a dengue fever. It's important to note that many people recover within a week or so. In some cases, symptoms worsen and can become life-threatening. Blood vessels often become damaged and leaky, and the number of clot-forming cells, which are known as platelets, in your bloodstream drops. This can cause a severe form of dengue fever called dengue hemorrhagic fever. Severe dengue or dengue shock syndrome. Signs and symptoms of dengue hemorrhagic fever or severe dengue is a life-threatening emergency, and these signs and symptoms include severe abdominal pain, persistent vomiting, bleeding from your gums or nose, blood in your urine, stools or vomit, bleeding under the skin which might look like bruising, difficult or rapid breathing, cold or clammy skin, which is a sort of shock condition, fatigue and irritability or restlessness. You should go to the nearest emergency medicine center if you have recently visited a region in which dengue fever is known to occur and you develop emergency symptoms such as severe abdominal pain, vomiting, difficulty breathing, or blood in your nose, gums, vomit, or stools. If you develop a fever and milder symptoms common to dengue fever, you should call your doctor. Now let me tell you some of the causes of dengue fever. This is caused by any one of 4 types of dengue viruses spread by mosquitoes that thrive in and near human lodgings. When a mosquito bites a person infected with the dengue virus, the virus enters the mosquito. When the infected mosquito then bites another person, the virus enters that person's bloodstream. After you have recovered from dengue fever, you have immunity to the type of the virus that infected you, but not to the other 3 dengue fever viruses. The risk of developing severe dengue fever, also known as dengue hemorrhagic fever, actually increases if you are infected a second, third or 4th time. Now let me tell you some of the risk factors. The factors that put you at greater risk of developing dengue fever or a more severe form of the disease include living or traveling in tropical areas. That is, being in tropical and subtropical areas increase your risk of exposure to the virus that causes dengue fever. Especially high-risk areas are Southeast Asia, the Western Pacific Island, Latin America and the Caribbean. And if you are having prior infection with the dengue fever virus. Previous infection with the dengue fever virus increases your risk of having severe symptoms if you are infected again. Now let me tell you some complication. As I told you, if there is a severe dengue fever, that can damage your lungs, liver and heart. Blood pressure can drop to very dangerous level that can cause shock, and in some cases death can happen. Now let's discuss some of the preventive measures. One dengue fever vaccine, that is known as dengue vaccine, is currently approved for use in those ages 9 to 45 who live in areas with a high incidence of dengue fever. The vaccine is given in 3 doses over the course of 12 months. Dengue vaccine prevents dengue infection slightly more than half the time. The vaccine is approved only for older children because younger vaccinated children appear to be at increased risk of severe dengue fever and hospitalization 2 years after receiving the vaccine. The World Health Organization stresses that the vaccine is not an effective tool on its own. The WHO said that the vaccine is not an effective tool on its own to reduce dengue fever in areas where the illness is very common. Controlling the mosquito population and human exposure is still the most critical part of preventive efforts. So for now, if you are living or traveling in an area where dengue fever is known to be, the best way to avoid dengue fever is to avoid being bitten by a mosquito that carries the disease. If you are living or traveling in tropical areas where dengue fever is common, these tips may help reduce your risk of mosquito bites. So I am going to tell you the tips which can reduce your mosquito bites. First of all, you should stay in air-conditioned or well-screened housing. The mosquitoes that carry the dengue fever are most active from dawn to dusk, but they can also bite at night. You should wear protective clothing when you go into mosquito-infested areas. Wear a long sleeve shirt, long pants, socks, and shoes. Also, you must use mosquito repellents such as permethrin that can be applied to your clothing, shoes, camping gear, and bed netting. You can also buy clothing made with permethrin already in it. For your skin, use a repellent containing at least a 10% concentration of DEET. Then the next important thing is reducing of mosquito habitat. The mosquitoes that carry the dengue fever virus typically live and around houses, breeding in standing water that can collect in such things as used automobile tires. You can help lower mosquito population by eliminating habitats where they lay their eggs. At least once a week, you should empty and clean containers that hold standing water, such as planting containers, animal dishes, and flower vases. Keep standing water containers covered between the cleanings. Coming to the diagnosis of this illness, dengue fever is difficult to diagnose because its signs and symptoms can be easily confused with those of other diseases such as malaria, typhoid fever, and leptospirosis. I have already made videos on malaria and typhoid fever. You can subscribe to my channel and you can watch those videos. And your doctor will likely ask about your medical and travel history. Be sure to describe international trips in detail, including the country you visited and the dates, as well as any contacts you may have had with mosquitoes. Some laboratory tests can detect evidence of dengue viruses, but test results usually come back too late to help direct treatment decision. Now let me tell you the treatment of dengue infection. There is no specific treatment for dengue fever which exists. The doctor may recommend that you drink plenty of fluids to avoid dehydration from vomiting and a high fever. While recovering from dengue fever, you should watch for signs and symptoms of dehydration. You should call your doctor right away if you develop some of these symptoms, which I am going to tell you now. Decreased urination, few or no tears, dry mouth or lips, lethargy or confusion, cold or clammy extremities. Acetaminophen, that is Tylenol, can alleviate pain and reduce fever. You should avoid pain relievers that can increase breathing complications such as aspirin, ibuprofen, and naproxen sodium. If you have severe dengue fever, you may need supportive care in the hospital. You may need IV fluids and electrolyte replacement, and the blood pressure monitoring will be done for you. And if there is a blood loss, then you may need blood transfusions. As I told you, there is a sudden drop in platelets also in this illness, so you may need transfusion. I hope you like this video. If you like my video, please subscribe to the channel if you have not done already. Then if you have any other question, or if you are suffering from any other illness, or if you want to discuss any problem, please post your comment.